What is CPR? CPR stands for cardiopulmonary resuscitation. According to the American Heart Association, most people do not feel comfortable in emergency situations because they do not know CPR. Say you and your friend are walking through the mall when suddenly she grabs her chest and falls to the floor. You check and see if she's responding, but she is not responding. She also does not appear to be breathing. What do? Well, first you want to call 911. But what do you do after 911? Well, if you do not know CPR, you will wait for emergency personnel to arrive. However, if you do know CPR, then you'll start CPR and you could possibly just save your best friend's life. Bystander CPR affects the survival and is the best treatment a cardiac arrest patient can receive until arrival of a defibrillator, according to the ACS study guide textbook. While interviewing Lorraine Stark, a 15-year paramedic, she reminded me of the ABCs of CPR. The steps of CPR is as easy as remembering your ABCs. A stands for airway. B stands for breathing. C stands for circulation. Airway. This is the first thing you're wanting to check. First, you're going to want to make sure the victim is turned onto their back. You want to check for breathing and then make sure the airway is clear. And you also want to make sure there's no obscurities in the airway. Next, you're going to want to tilt their head up and their chin out. This allows for free airflow from you to the patient's lungs. B stands for breathing. Next, you're going to want to pinch their nostrils as so no breath comes out while you're breathing the air into the victim. Then you want to give 2 solid breaths, making sure the air, make sure the chest rises and falls with each breath. C stands for circulation. You circulate the air through the body by using chest compressions. You start chest compressions by using both of your hands. You want to put one behind the other and interlock your fingers. Using the palm of your bottom hand, you want to put it in the center of their chest. You push down the chest for about 2 inches for each compression. You will do 30 compressions for every 2 breaths you give to the victim. There's also what's called as hands-only CPR. The American Heart Association recommends you do hands-only CPR when the victim is a stranger and you do not feel comfortable doing mouth-to-mouth resuscitation. As I have stated, the ABCs of CPR is as easy as remembering your ABCs. Airway. You want to make sure the patient has a clear airway so they can get air to the lungs. B for breathing. You want to give the patient 2 solid breaths for each, and make sure their chest is raising for each breath. C stands for circulation. You circulate the air through the body using chest compressions. You want to give 30 chest compressions for every 2 breaths you give the patient. According to heart.org, the American Heart Association's website, effective bystander CPR provided immediately after sudden cardiac arrest can double or triple a victim's chance of survival.